Diagnosis: a doctor may diagnose bladder cancer using number of tests including urinalysis, checks for blood, cancer cells and other substances in the urine. Urine cytology: examine urine under a microscope so to look for cancer cells. Cystoscopy is a procedure in which doctor inserts a small, narrow tube, cystoscope, with a camera through urethra into the bladder to directly visualize the bladder lining and look for tumors. If abnormal tissues are detected, then tissue sample will be taken. Biopsy and are examined under microscope to confirm the presence of cancer cells and determine the type of bladder cancer. Biopsy: tissue samples taken during cystoscopy are examined under a microscope to confirm the presence of cancer cells and determine the type of bladder cancer. If urinalysis, cytology, cystoscopy show bladder cancer, then certain tests are to be done that may include chest X-ray to check if cancer has spread to lungs, computed tomography scan, CT scan to check if cancer has spread to nearby organs or lymph nodes, magnetic resonance imaging, MRI to check detailed images of bladder, bone scan to check if cancer has spread to the bones. Tumor grading. Grade 1, low-grade cells look more like normal cells and usually grow and spread more slowly. Grade 2, intermediate grade cells have more abnormalities than grade 1 cells. Grade 3, high-grade cells look very abnormal and are likely to grow and spread more aggressively. Staging describes the extent of cancer spread and is crucial for treatment planning. The TNM system is commonly used. T. Tumor. Invasive bladder tumors can range from T2, muscle layer of the bladder, all the way to T4. Tumor invades nearby organs or structures, e.g. prostate, uterus, vagina. N. Nodes. Lymph node involvement ranges from N0, no cancer in lymph nodes, to N3, cancer in many lymph nodes along the common iliac arteries involved. M. Metastasis. M0 means no distant metastasis, and M1 distant metastasis present. Treatment. The treatment is based on the stage and grade of the cancer, as well as the patient's overall health and preferences. Common treatment options include: surgery is a common bladder treatment and is chosen on the basis of cancer stage. These include transurethral resection, TURBT removes tumors from the bladder lining. Cystectomy, if cancer has spread deeper into the bladder, then there may be partial or complete removal of the bladder. Reconstructive surgery, to create a new way for urine to exit the body if the bladder is removed. Chemotherapy. Systemic chemotherapy targets cancer cells throughout the body. It can also treat cancer before or after surgery. Immunotherapy, drugs that help the immune system recognize and attack cancer cells. There are different types of immunotherapy. BCG therapy, Bacillus calmette drugs placed directly into the bladder. This is also helps to boost immune system. PD-1 PD-L1 inhibitors, drugs like pembrolizumab, Keytruda, and atezolizumab, Tecentriq, block the interaction between PD-1 on T cells and PD-L1 on cancer cells, enhancing the immune response against cancer cells. Radiation therapy, high-energy beams to kill cancer cells, often combined with chemotherapy. It may be helpful for people who cannot have surgery. Targeted therapy, drugs that target specific molecules involved in cancer growth and spread, e.g. drugs like FGFR gene inhibitors target cells with gene changes that help cancer cells grow. Follow-up and monitoring. Regular follow-up is crucial to monitor for recurrence or progression of bladder cancer. This typically includes periodic cystoscopy, urine tests, imaging tests as needed. Note: early detection and accurate diagnosis of urinary bladder cancer are essential for effective treatment and improved outcomes. If you experience any symptoms or have risk factors, it is important to consult with a doctor for a thorough evaluation. Thank you for watching my video. For more videos, kindly like, share and subscribe.